So I'm happy you're going to be able to get something to keep your airway open at nighttime. We've sent you a video that is produced by the company that makes your myTAP. Make sure you watch that video at least once, twice, whatever you need. It's pretty straightforward, and this fitting a myTAP is very easy, but you got to make sure you watch the video. This video is done so you have a little bit of extra help, some tips from somebody who's done hundreds and hundreds of myTAPs for people over many, many years. I think this is a fantastic little device. I'm sure you'll be able to use it well, but it does take a little bit of fitting. So what's a key here? Make sure that you have a few things. You need to boil some water. We use a little hot pot like this. You can get it anywhere. But if you don't have one of these, just use a teapot or use a pot on your stove. But it has to be boiling water. When you take the myTAP out of the device, out of the little gray box it comes in rather, then what you'll do is you'll take a clear plastic knob off the front and to make sure you can separate the pieces. It's very important that you take the clear plastic knob and you put it back in the gray box, because it's very easy to lose that little clear plastic knob. And if you do, you won't have a myTAP to use at all because you can't find a replacement. And so put that back in the gray box and take these apart, just like this. Now, as you saw in the video, make sure you boil the upper one first. And so the upper one's easy to put in your mouth. So you put this in boiling water, make sure it's a whole minute. Now I'm not going to go through that because you just saw it on the video, but I'm going to show you a couple of tips. So after it's all heated up, the video says you put it over the teeth and you make sure it's straight. That's an important part. And once it's in your mouth, it says bite gently onto the myTAP. I want you to bite fairly firmly onto the myTAP with your lower teeth against the warmer upper one. So you bite firmly against the myTAP part, and the video also says do not push against the sides with your fingers. I want to change that too. So when it's warmed in your mouth, lined up straight, biting firmly, take your fingers and just push against the sides of your cheek to make sure this portion right here adapts to the sides of your upper teeth. We want it to kind of grip side to side on your upper arch. So go ahead and do that and leave it in your mouth for a full 3 minutes. That's very important as well. Then when you tease it out of your mouth after it's all nice and firmed up, it won't be completely cool. You put it in some cool water. You don't have to put it in ice water, but cool water's fine. And set that aside while you fit the lower one. Now here's a tip for the lower one. So now you put this in the boiling water, or you've boiled water and poured it over this and wait for at least a minute on both upper and lower to make sure that it gets all the way clear. When you go to put the lower one in your mouth, you'll want to make sure you open wide and lift your tongue to the roof of your mouth. So open and just lift your tongue up. So then when you put this in place, your tongue will be on top of this device. Very important about that. If you don't lift your tongue up, then very likely you'll fold over this inside portion here where this sits next to your tongue. Don't worry if you do that. I'm going to tell you about that in just a minute. But lift your tongue up, put it in your mouth, and like on the upper one, you bite kind of firmly on it. But now you can't push from the side. That's not really going to help you very much. This one you have to push with your tongue. So it's in your mouth, you're biting on it kind of firmly, not clenching, but kind of firmly. And then take your tongue and just move it side to side to push these little wings here against the sides of your lower teeth. So just move your tongue, not your bite, just your tongue side to side. Now, if you don't think you can do that, then open a little bit, take your wet finger and make sure and just rub it next to the insides of those lower teeth. And then after 3 minutes of kind of going back and forth on that, then you can tease it out and put it in the cold water as well. It's important to have a wet finger when you're managing these. It's also important to make sure you don't boil them together, because if you put them together in hot water, they stick to each other. Don't worry. Just keep boiling the water. You might have to pull them out together and put them in boiling water, and then they'll separate. So hot water won't do, but boiling water will. Now here's an extra cool tip for working with this material. If you've put it in place and you didn't get it quite right, something folded over, it doesn't fit your teeth very well, for whatever reason it doesn't work out well, there's a magic part of this. You put it back in the pot that you were boiling the water in and boil it some more. So if you have a stovetop pot, just put it in that and boil it. So as you boil it, you can't hurt it, as you boil it, it'll return to this shape. Doesn't do that with hot water. You have to put it in boiling water and wait just a little bit, and you'll see it come back to shape. Don't try and unfold it. Don't take an instrument or a spoon or a fork and pull it open, that kind of thing. Just put it in the water. It'll return to its normal shape, and then take it out, let it cool down a little bit, and then you can put it back in your mouth and try again. And you can do that a bunch of different times. Of course, we're here to help you, so if you need some coaching on this, just give us a call and we'll get in touch with you about that. But I think you'll be able to see how that works out super well that way. If you're having trouble fitting it in your mouth, then you can take a spoon or something and hold your cheek out of the way. Just any way you can kind of work it in there to make sure it lines up over your teeth, and then fit it up over your teeth to make it work well, or fit it over the lower teeth, those kind of things. Those are all little tips you can use for that. Make sure you don't put these together when they're at the same time, when they're sticky or they're clear. So if you've fitted the upper one, you got to take that out of your mouth before you fit the lower one. If you don't do that, they'll stick together. And here's something else that you might discover about that lower one. After you make the lower one, every now and then, on some people's arches, they have a little part of it in the back that sticks up. You can see this little portion that sticks up. Sometimes it's a lot bigger than that. It sticks way up here. If you find that's true in your mouth, it might feel uncomfortable later. So if you have a little part on the lower that sticks up like that, then what you do is you just heat up that end of it. So you just put that end of it in hot water and get a little bit soft, and just take some scissors and cut it off. It won't work if you try and cut it when it's not hot, and you don't want to set the whole thing in hot water because you don't need to refit it. But all you got to do is heat up that little section, cut off the part that sticks up, and it'll make it a lot more comfortable for you. Very important little tip right there. So once you've had this all fitted, so it's nice and cooled down, when you put it over your teeth, it might be very tight because this stuff shrinks a little bit. That's okay. It's actually better to be too tight than too loose. But if it's too tight so it's uncomfortable, then what you do then is just dip it in some warm water and put it in, take it out, put it in, take it out. You can do one at a time or both of them at that point because you're not really heating them up all the way. So you put it in, take it out, put it in, take it out, and that way it'll loosen it, relax the fit just a little bit, and you'll be able to make sure that that works out well for you. So it's pretty simple to make a myTAP that works. It's a little technique parts, but it's really just about doing simple things. Watch the video, watch this video, think about it a little bit, and you'll be able to make a myTAP that'll fit you very well and get a chance to help you breathe really great while we're waiting for a chance to do a custom device, or whether your CPAP is going to work again for you, or whatever reason we're doing a myTAP during this time. So I hope that you like it, and call us if you have any concerns.